Hello, my name is Krista Senadinas, and I'm the director of the Northwest School for Botanical Studies and author of the Essential Guide to Western Botanical Medicine. And I'm here on one of my favorite places to walk on the Pacific Northwest coast in Trinidad, California. And I noticed one of our plant allies popping up here, and I wanted to spend a few moments talking about it. So this is Petasites palmatus, varietal frigidus. Petasites palmatus, varietal frigidus, otherwise known as Western Coltsfoot, and it's a plant that grows in colonies in moist areas, usually along stream beds or where there's abundant water. And normally you'll find one leaf per stem, and the leaves have a palmate shape. They have a lighter color underside and a darker upper side, and they're slightly fuzzy. And when I harvest these plants, I usually cut them at the base of the stem down here, and I bundle a few of the leaves up, rubber band them, and hang them up to dry. And I use them in hot infusions, and also will dry them for smoking mixes. And they are great to use as an expectorant, respiratory antitussive or respiratory antispasmodic, and they have subtle soothing demulcent qualities and a nice aromatic smell to them. They're very mild tasting in blends and pleasant to drink. And what I use them for is the first stages of a cold or flu. They're great for reducing a scratchy throat, or if you have a kind of irritative tickle, you can't stop coughing when the trachea is irritated. So first stages of a cold or flu, just to soothe the mucous membranes and soothe the upper and lower respiratory tract. They can also be used if a lower respiratory infection occurs. They don't have antimicrobial properties, so you'll need other anti-infectives to treat the bacteria or virus, but they can be used as an adjunct for treating bronchitis, pneumonia, any type of wheezing, even wheezing from COPD, and subtle wheezing from asthma. So great upper respiratory and lower respiratory antispasmodic, demulcent, a mild anti-inflammatory to the mucous membranes. What else? It's light antispasmodic for the digestive tract, so it can be mildly helpful for gut cramping and intestinal colic. And then you can include it in smoking blends, and it will have expectorant and antitussive properties in smoking blends, but of course smoking is not recommended if you have lung irritation. It would just be a good substitute for individuals who smoke tobacco who have lower respiratory infections and want to continue smoking. And it will open up the airways a little bit and help thin and expel mucus. It contains pyrrolizidine alkaloids, or PAs. Pyrrolizidine alkaloids, when ingested for more than 4 to 6 weeks per year, can have an accumulative effect and eventually can contribute to veno-occlusion or portal veno-occlusive liver disease, or VOLD. Basically, it causes obstruction of the portal vein that brings blood from the intestines to the liver, so that's very dangerous. I want to avoid that. That's part of why high doses long-term of PA-containing plants have been widely cautioned. Other plants like comfrey and borage also contain PAs. But you can safely use this for anywhere from 2 to tops 6 weeks, but I typically stick with 2 to 4 weeks per year. And again, this is Petasites palmatus, varietal frigidus, otherwise known as Western Coltsfoot. Oh, I should mention, I recommend avoiding this, consuming this during pregnancy, lactation, in small children, individuals with compromised liver function or liver disease, or individuals taking medication that compromise liver function. And it's Krista Senadinas, Northwest School for Botanical Studies. Thanks for learning about Coltsfoot with me.